4-way hip isometrics. So this is a series of movements that we do often when someone has an irritated hip joint. Maybe they're coming off a post-surgical, they're post-surgical, meaning they can't move that hip through a ton of active range of motion, or you're someone that gets an irritated hip joint. The isometric allows us to contract all the muscles around the hip without changing a lot of length, meaning you don't get a lot of mechanical shearing inside the hip joint. So what we prefer to use is a yoga block, and then for this example, I have an actual lifting belt, but this could be like a really heavy resistance band. It could be like a clothing belt from home. It could be a ratchet strap, a nylon, just something that is close to being immovable with very minimal stretch so you can get a good isometric contraction. What we like to do is we like to take the yoga block, put that between our knees. You can kind of play with how wide you want the setup to be. That's why we really like a yoga block. So for this example, I'm gonna have it in the narrow position. And then what I'll do is I can take this belt and I can wrap the belt around my knees. Maybe. And I can pull that. So this example, I grabbed a belt that was just a little bit too short, which is fine. I can just hold on to it. But what I'm gonna do is I'm trying to keep my feet hip width apart. I'm gonna push my low back into the ground, so I'm in a neutral pelvic position. And then I'm gonna squeeze my knees together, and I'm gonna hold that for maybe 3 or 4 seconds. And usually we'll dictate that for you, how long the hold is gonna be. It's not uncommon for us to give you 10 seconds. So say I push together for 10 seconds, then what I'm gonna do is I'm gonna push out into the belt for 10 seconds. Now you're trying to go just straight out and not up. So where you should feel this, if you keep your low back down, is kind of the outside of the hip. After 10 seconds, what I'll do is I'll push my left foot into the ground and I'll pull my right knee off the ground. So the foot actually comes off the ground. So I'm coming into hip flexion on the right side and hip extension on the left side. I'll hold that for 10 seconds and then I'll switch and go the opposite way. So really what we're doing is we're training adduction, abduction, flexion, and extension. Hence the name 4-way hip isometric. And really how hard you push or don't push is entirely up to you relative to your symptoms. So if you're someone who's got a really achy or cranky hip, start really, really low intensity. And then as your central nervous system gets exposed to load and it kind of calms it down, you can ramp up how hard you're doing each one of those holds. So again, usually we'll give you 10 seconds in each direction. Just take a look at your notes. It'll be dictated in there for you. And then the last piece is your reps, right? So if I go adduction or I squeeze together and then I push out and then I go opposite foot each direction, opposite foot each direction, that's an example of 1 rep. And then you'll have several reps that make up each set.